The adjuvant chemotherapy will destroy the remaining cancer and reduce the risk of a cancer recurrence.
So now move on to question 2. As Taiwanese patients now have access to an increasing number of new therapeutic agents, could you share your insights on the common systemic regimens employed in the treatment of early breast cancer?
According to our latest data of Healthy Promotion Administration, Minister of Healthy Welfare at Taiwan, it's about over 50% newly diagnosed early breast cancer will receive the chemotherapy. But I think the amount will change because when we increase use our multiple gene acid, we may lower our chemotherapy rate because we know some case we only need a hormone therapy for those ER positive case. And in the amount our chemotherapy agent, the anthracycline and the taxane-based chemotherapy is a key regimen for our early breast patient to achieve our PCR or even will cure our patient.
So drawing from your valuable clinical experience, could you share some of the limitations encountered when prescribing these chemotherapy agents?
For example, the anthracycline will induce some heart failure, could be a life-threatening.
So as an experienced breast cancer expert, in the present day, are there any viable solutions to address these limitations?
Okay, we have to diminish the chemotherapy-related toxicity